Good day, everyone. I am Michelle Proctor-Sims, Director of the Nova Scotia Advisory Commission on AIDS. I will begin by acknowledging that this ceremony is taking place in Mi'kma'ki, the traditional unceded territory of the Mi'kmaq people. We are all treaty people. On behalf of the Advisory Commission on AIDS, thank you for taking the time to join us in marking World AIDS Day and the beginning of Aboriginal HIV/AIDS Awareness Week in Nova Scotia. Almost 40 years ago, in 1981, the first cases of what we now know to be HIV/AIDS were emerging in North America. The first World AIDS Day was commemorated in 1988, and in 1991, the red ribbon became the international symbol of AIDS awareness. Today, we honor all those affected by and the millions of people who have lost their lives to HIV infection with a proclamation and the raising of the red ribbon flag. Today is also an opportunity to reflect on the significant achievements and advancements in HIV prevention, testing, and treatment. We also recognize the work that needs to be done, including making it easier to access testing for HIV and other sexually transmitted and bloodborne pathogens, prevention measures such as HIV pre-exposure prophylaxis or PrEP, and for reducing stigma, particularly for those with multiple marginalized identities, such as queer, transgender, Black, Indigenous, and other people of color. This year, World AIDS Day comes in the midst of the COVID-19 pandemic, a situation that has increased the urgency and importance of finding ways to address barriers to testing and linkages to care. We are grateful to have the Honorable Leo Glavine, Minister of Health and Wellness, to give remarks. It is my pleasure to now invite Minister Glavine to say a few words.
Thank you, Michelle. Hello, everyone. I am pleased to be here today to mark HIV/AIDS Awareness Week and World AIDS Day. Although we cannot be together physically this year, it's great to see people come together virtually to support such an important cause. Today we honor Nova Scotians who have died as a result of AIDS, and all those currently living with HIV/AIDS. Prevention, early diagnosis, and access to ongoing care and treatment are vitally important in the fight against this disease. Through the Nova Scotia Advisory Commission on AIDS and other partner organizations, we've made significant progress in our response to HIV/AIDS and other sexually transmitted and blood-borne diseases. The Commission continues to provide advice to government and act as a liaison for communities on HIV prevention, care, treatment, and support. This year's international theme, Global Solidarity, Shared Responsibility, is especially fitting for 2020. The COVID-19 pandemic has demanded that governments, communities, and the healthcare sector find new ways to do things. We not only had to find new ways to deliver health care and other services, but we had to do it very quickly. Testing for COVID-19 is a perfect example. It required that we urgently mobilize resources from across the province to build the capacity we knew we'd need. I know this has had an impact on the availability and accessibility of other kinds of testing, including for HIV. Early this month, Health Canada approved the first HIV self-test in Canada. This is a 1-minute finger prick blood test, and the science is very promising. We're already working with our colleagues at the Commission to better understand these tests and how they might be used in Nova Scotia. I also want to recognize the disproportionate impact COVID-19 pandemic has had on certain populations. Many people living with HIV and those at risk of contracting the virus are also at higher risk of severe COVID-19 infection, which has created even more challenges for the people who need services and those who deliver them. In Nova Scotia, we have many people and organizations who work tirelessly in the response to HIV/AIDS and related issues. They have and continue to make a huge difference in many lives and to our province. And on behalf of the province, I want to thank you for your commitment. I look forward to continuing our work together on our shared goals. I encourage all Nova Scotians to honor our friends and neighbors living with HIV/AIDS and those who have died, not just today, but every day. On behalf of Premier Stephen McNeil, the proclamation, HIV/AIDS Awareness Week, Aboriginal AIDS Awareness Week, and World AIDS Day. Whereas more than 63,000 people are living with HIV in Canada and 14% are undiagnosed. And whereas innovative testing technologies and approaches to reach those who need it with timely access to prevention, treatment, and support services are critical to ending this epidemic. And whereas World AIDS Day is a time for people around the world to commemorate the many lives lost from HIV/AIDS-related illnesses and commit to efforts to increase access to testing, care, treatment, and support for those living with or at a high risk of HIV infection. Therefore, Stephen McNeil, Premier of Nova Scotia, do hereby proclaim November 24 to December 1st, 2020, to be HIV/AIDS Awareness Week, December 1st to December 3rd, 2020, to be Aboriginal AIDS Awareness Week, and December 1st, 2020, to be World AIDS Day here in the province of Nova Scotia. Signed by the Honourable Stephen McNeil, Premier of Nova Scotia.
I now invite Minister Levine to raise the flag. Thank you, Minister, for your words and presence today. To the stakeholders and partners we work with every day, thank you. We invite all of you watching today to mark World AIDS Day by wearing a red ribbon, educating yourself about HIV and AIDS, and attending other events either virtually or in your community. Thank you.